it's Melanie Petro, and we are doing some Volbella today. This is our very funny patient, and I asked her what happened right there. You want to tell them?
I think I ate my lip ring.
It happens. We've all been there.
She said eating the lip ring?
She said she was
that is beautiful.
eating her sandwich the other day, and you just never know. But we're
here looking at her lower legs. So what got you interested in wanting, child of mine, what got you interested in doing your lower legs?
I just look sleepy all the time.
Do people say stuff to you?
No, everyone is nice and it's like, I don't even see what you're talking about. I'm like, you're delusional.
You got some good friends. Because a lot of people feel like their friends are either trying to like wipe the dark circles away, you know, and you're a pretty girl, but that's the first thing I see. Other than that nose ring, I wish you would get rid of. But right there, you may with this, it may inspire you. They can just leave bad scars, you know?
Yes.
So she's got this area right here, and it's a little bit flat. It's flatter on this side than it is on this side. It kind of looks like that. So I'm going to add some Volbella here, and what it's going to do is lighten your face so that when you look in the mirror, you're young. How old are you?
33.
So you're very young. This is going to make you look even younger.
Good.
And she is going to the beach soon, so we'll make sure that she's.
So it can definitely make you bruise. If it does, we treat it with a laser.
Mm-hmm.
Okay.
You do it before you go. You put your head back for me.
Okay.
Now, when she puts her head back, it changes where it is. I'll have her sit up at some point, too. So to try to keep her from bruising, we'll use some of this. Will you scoot towards me a little? You're so little.
I will.
So you're going to put that back in, or you want to laser and close it up?
Oh, that lip ring?
Yeah.
She likes it.
I do love my lip ring.
I think she rocks it.
Will it go? How long do you have? You have.
I'll have to get one in it by tomorrow, probably. I think I ate it yesterday.
Probably neat if you can make it a candy one, you know.
Yes. I don't know how the fruit
Sure
come
they
off
make
of it.
those.
I'm sure you weren't the first
Chloe knows where to buy them.
person that's ever happened to. Dylan's candy bar. What, the lip rings?
My friend,
Edible ring.
Oh.
my friend thought she ate
Dylan's
hers last
candy
year.
bar.
Dylan's candy bar.
We had the best experience at
anything
Dylan's
ring.
Candy Bar.
Yes.
We went. Chloe got ice cream with like 18 things in it, right?
Every kind of candy in it.
I've never been there.
I got gummy cherries, of course, and junior mints and diet. All my favorites.
And Tisha,
Tisha,
if you're watching,
pregnant, Tisha got a big thing of cinnamon jelly beans, and she spilled them
right
on
at the
floor
checkout
of
counter.
It was the funniest thing. So the icing it fermented is going to help vasoconstrict the little vessels. And she's flat here, and this is where she's a little bit dark. So this is Volbella. It's the only thing I'll use because it is so pretty.
And Volbella is newer on the market, but we've been doing it here for a while, and it lasts about a year. So she should be good. Does it hurt?
No.
So that's kind of almost smooth it out.
You're probably a trooper with needles, though, so it doesn't bother you.
No, that
You
was
just put it on the other side of your hand so you don't get it all over me. So VZ is getting some gel.
Just your gel. She'll apply it when
Goes
we're
with
done.
all the filters right now, doesn't it?
Okay.
Open your mouth. Look at me. Okay.
Hey, Miss Harris.
So Volbella lasts a year. That's about half of it. Most people take. Put your head, chin down. Sit up for me. Stay sitting up for 1 second. She has no volume, so it just. You gotta add it.
Miss Roberts says she loves your live feeds and would love to have this done. This is for a lot of patients who feel like, if you have saggy, puffy under eyes or dark circles, the Volbella is perfect and it looks so, so pretty. And our patient is going to love it. 1 to 10 for our viewers. How does it feel 1 to 10 as far as pain? 10 being painful.
Oh, like a 3.
Like a 3. Okay.
The last stick was the only one I actually felt.
So not bad at all.
I mean, that's not a place that most people don't need it, but had to aspirate a little bit to make sure. It's looking so good.
All right, you want to sit up a little bit so you can see? Oh my gosh.
I got more to
Yeah,
go.
it's looking awesome.
Very, very pretty. Hey, Peyton, could you grab that mirror for her so she can look at it? All right.
Put your head back for me. We can post pictures too.
Yeah, we'll show you guys a before and after side by side. You're going to love it. And how many syringes, Dr. Petro, do most people typically need?
Some people can do one. It is not a full syringe, like it's 0.6. And it lasts a year, and it doesn't absorb a lot of water. It's a different form of hyaluronic acid, so it's going to absorb less water than Juvederm, so it doesn't swell as much. But typically, one per eye. But you can always do. She could have told me no, she wanted to do half and half, but it just wouldn't correct all the way around.
Okay.
Sit up for me. Let me see again. That's looking really good.
I'm going to get a shot real quick. Very pretty. Obviously, you can see where the needle went, but you can also see the difference in the volume underneath this eye right here. The one on the right is the
And
one
I'm
we
still
just
following
did.
it around. I'm not done.
Oh.
And Dr. Petro
Okay,
is a
sorry.
perfectionist in the best way.
Finally found a use for it. That's what my dad would say.
Mm-hmm. Your dad would be very proud.
Okay. You okay?
I am.
I missed him.
I was just trying to be still.
You're doing great.
I'm so focused on being still.
So we'll get
It's a
Chastity
lot,
to
it's
touch
hard.
where that little- And the dark skinned people, we can cover up bruises really well.
All right.
Let's let her see.
Miss Harris asked,
See.
if a person needs two different types of filler, would you do them both
excited.
the same day or would you break it up? Typically, we could do them both on
Yeah.
the same day.
I would do them both the same day. That looks really good.
Well, I'm
Very,
excited.
very
It gets a little
pretty.
puffy, but it's
There
going
you
to
go.
be really pretty.
I'm gonna take a look.
Y'all hold the eyes.
Oh yeah, I can tell it's gonna fill out.
Oh yeah. The kind of filling out you want.
Yes.
Not the kind Mary Peyton's doing on her filters of my mouth. The only one that thinks mouths are pretty. I mean, it's a mouth filter. Like, I know what Snapchat does the
I
nose
like the mouth.
filters. I know
I
you
want
do.
a bigger mouth.
I'll trade mouths with you.
I will.
All right, Miss
Your mouth.
Daly commented and she says she knows it helps the bag underneath the eyes. Does it also help with the fat pad underneath the eye?
It doesn't. That's a surgical hold pressure right there.
Okay.
You okay?
So for fat pads
I am.
under the eye, she would probably recommend.
You know, that's something you really have to surgically remove. She's young. She doesn't have a fat pad. She's just got hollowing. And then it makes it look dark.
Mm-hmm.
If the fat pad is real light, you can add a little underneath it if surgery is not an option.
Right. So basically, if that's something you're
But
interested in, you
it just
could,
depends. You gotta have to see it.
yeah, consult with Dr. Petro. She'll tell you.
Because what you don't want to do is just make your whole face look fat.
Yes, Miss Neighbors, the Volbella was actually FDA approved to
Lip line.
fill in the lip lines around the mouth. So, if that's something you want to do, Volbella is perfect for that as well.
This is kind of an off-label use, kind of like we use Botox. Botox is only approved for the Volbella and the crow's feet. It just got approved for the crow's feet. We put it everywhere.
Ah,
We know it's safe. Look at it. Looks really good. This side's
can you
not gonna
guys tell the
bruise.
difference
This side's
already?
probably not going to bruise.
It's very satisfying to watch because you can see the volume. So pretty.
Just hold it.
And what we do anytime we do the filler, she numbed, and we didn't show you that part, but we always let patients numb for about 20 minutes or so that they don't feel any pain or discomfort. I think she's still doing good, just trying to stay really still. She's doing perfect.
I'm good. It does not hurt at all.
Awesome.
And it just, I don't like, some people do use the cannulas. I just don't like them. I like to see exactly what I'm doing, exactly where I'm putting it, exactly
How
the
long does
spot.
this last? If you're just not joining, we're doing the Volbella, the filler for her tear troughs, and it lasts about a year.
And put your head back.
Which do you prefer to do on lip lines and forehead lines, the Volbella or the Botox? Botox is for your forehead lines.
Yeah, you don't normally put filler in. Botox is for muscles that move when your face moves.
So you would do Volbella for your lip lines and Botox for your forehead lines.
I still do Botox for lip lines too. They work
Yeah.
really well together, as a matter of fact.
Yeah, she has been doing a lot together, so it kind of
That
just
way it
depends
makes your stuff last longer. So
Mhm.
let me see.
what you need.
I'm real happy with that eye. I'm going to have to play with this one. It's the side that's flatter.
It's truly a work of art.
I'll tell you, I had this done. Dr. Jordan did it for me in residency. He did a really good job. And then somebody said, oh, I can do it without that many sticks. It won't hurt a bit. Much like my personality, I completely believed him. And I had a huge lump, and I had to dissolve it. And it, you know, this area is tricky because the eyelid skin is so thin. So you just, that's why there's so many little sticks, because it has to be absolutely exact or you'll see it. But the Bella is thinner than the Restylane. I don't think I've used Restylane since I got this. I love it for this. It's just better than anything else. I have it under my eyes. I'll have to show y'all that video someday. We forgot the sound. It was me and Amy.
Summer Nicole says she really wants the lines around her mouth done. You'll have to come in and see us for a consultation, and that way we could decide which you want to do, the Botox or Volbella, and we could do it that same day.
Look at me. Smile. Relax.
So pretty.
Can't put much more there. It's a balloon. Okay, put your head back.
If anyone else, I know a lot of people just joined, so if y'all have any questions, you can comment below.
It's really all about angles too. Like I can't just look from one angle. I'm gonna look from back here too.
You'll notice she keeps having her sit up, and then she lays her back down,
And
but
this is really the only area that really gets that important. But you know, I guess I have my theories, but I won't tell you that. But everybody looks good laying down.
a consultation
If you
for
have not done a
injectables is
selfie laying
free.
down, you need to do one because everybody looks good laying down. So when she lays down,
And a
it
good cry is
changes.
nice, everyone's just kidding.
Why would a good cry? It always makes you look.
Take a
white.
picture of yourself laying down. I was just saying if you need a good cry.
No, you're better, not your body. Your
Oh.
face is better laying down. We're going to do that experiment.
Because all the volume goes back and
Yeah,
you look
so when
down.
she lays back, I can't even see this, but I can see where I want to add a little bit more. And this is one of those things where it's just angles, angles, angles. I got to master train with the coolest guy.
Say hello. Oh, okay.
He liked women, y'all would never see me again. But Brazilian accent.
Y'all can follow us on Snapchat too. We're doing some snaps. Lord knows what kind of filters Mary Peyton's working with today.
Peyton thinks that the beard filter is cute. I am failing to see that. I mean,
Don't y'all just want to be the person whose job it is to come up
Right.
with the Snapchat filters?
well, I know what they were thinking. Y'all clearly don't. That's okay. I can handle it.
All right.
I'm going to add a little bit right in here, and some of that's just puffiness, but this side is flatter. Switch needles. Mama's done.
It's a process, but
I'm excited.
worth the time she takes.
And it does take a minute, so I ended up having to have mine dissolved because in the mornings I couldn't see over it at work. And it was somebody who put Juvederm because Juvederm had just come out.
Miss Harris says she never knew there was anything for bags in darkness. Volbella is newer on the market. We used to do Restylane, but as she said a second ago, I don't think we've done any wrestling since we got the Volbella. It's really pretty.
I'd love to run a special on it, but I'm scared people will do it, and I like this too much.
Yeah.
I'd rather just me lose it than do it. That is the truth. If I could just get that picky about the cleanliness of my house. I'm trying. There's stuff everywhere. So
And
y'all need a spring. This is let's see. So when she animates, relax. I relax, and when I pull it down, I can see that little vein, so I can avoid it. There are only a few I can't avoid. So that's perfect. I'm gonna put the rest in your brow. Is that okay?
Okay.
I'm going to tell people why are you
So
putting
you
in the
see
brow.
how little it took just to give it a little lift.
She wanted to
Looks so
give the
good.
brow just
Love
a
it.
tiny
Brow.
lift. Symmetry
so
is
people
everything.
used to say, this is what happens when a bunch of men talk about aging, but they used to say that you had to have an arch here, which most of us never liked. I've been putting all kinds of stuff in my lateral brow for a long time, and now at least everybody recognizes it's a fat pad that falls down. So just that little tiny bit makes a huge difference. You know, it gives you a lift, and as young as you are, forehead. See how it gives you a lift?
Oh, yeah.
We're going to zap that with our laser before you go.
Okay.
Yeah, she has a beach trip next week. We don't want her to
All
bruise,
those little dots
so
will be gone. You can cover it up.
Dr. Petro has a laser that helps with bruising in case any of you guys know that you're prone to
We
it.
love her fingernail polish.
Show them your nails. They match our walls.
Only like one color. Are you
Yes.
sure, Ralph? So we're going to do some Botox in her forehead. What she probably, when you look at how you age, you'll age. You've already done this.
I've done Botox before.
Okay. But have you seen, like, you know, that line that gets across your forehead?
Yes,
That's
it's just like...
and that's kind of what makes you age kind of like your family does. So if anybody wants to know, they can always look at that. Men are the only ones that are like, you really think it'll get deeper? So it says I need Botox, but I don't feel like I do. What do you